When stomach contents travel back up into the esophagus, acid reflux is said to occur. It's fairly typical to experience this motion occasionally, which is known as acid regurgitation or gastroesophageal reflux disease, GERD. However, gastroesophageal reflux disease may be present if you are experiencing this more than twice per week or frequently. It can occasionally lead to major problems if left untreated. But while the majority of people may permanently relieve their symptoms by dietary modifications and other over-the-counter remedies, some GERD sufferers may require harsher drugs or surgery to do so. So now let us see what are the symptoms. Acid reflux is the primary symptom of gastroesophageal reflux disease. A burning sensation that starts in your chest and travels up into your neck and throat is a common symptom of acid reflux. It is retrosternal in nature. This sensation frequently begins behind the sternum in the middle of the chest. You can have a painful or bitter taste in the back of your mouth. If you have acid reflux after eating or drinking, you may get heartburn or burning. Some exacerbating factors or things that make the heartburn worse. These include lying down. So when you're lying down, you can imagine that if this lower sphincter is open, if you lie down, the acid can pull back into your esophagus, burning your esophagus. So that is a reason why lying down, especially lying down flat, can worsen your symptoms. Eating late at night. Again, for similar reasons, if you're eating late at night, oftentimes you're going to lay down and this can worsen symptoms. Certain dietary choices can worsen symptoms. So some of these dietary choices include things like chocolate, caffeine and alcohol. Also, eating too quickly is also an exasperating factor as well. Liking our video. Don't forget to like and subscribe to our channel for more of our educative contents. Another indication of gastroesophageal reflux illness is dental problems. This may frequently be disregarded. People with gastroesophageal reflux disease, GERD, can have problems with dental hygiene, including problems with gum recession, which causes their gums to recede. They can also have problems with an increased risk of dental erosions, and having GERD as a risk factor independently for chronic periodontitis. It's important to consider these issues in addition to some other GERD signs and symptoms. Regurgitation is a common symptom of GERD. The lower esophageal sphincter is open, which makes it easier for food from the stomach to reflux upward and can cause problems with regurgitation. You can regurgitate up partially digested food as a result. We can also see hoarseness being a sign of GERD, and this again is due to acid reflux irritating the vocal cords, so there may be some issue with talking as well as choking up. Assuming a person has a chronic cough that lasts more than 2 months, GERD may be the cause. If other possibilities have been ruled out, it should be noted that the coughing is frequently worse at night. This is because there is more reflux in the esophagus while you're lying down flat. GERD can cause coughing problems, and GERD is really a common cause of chronic cough. The reason why coughing can happen with gastroesophageal reflux disease is because the acid reflux can irritate the airways. Belching is also another important symptom of GERD. Again, this is due to reflux and relaxation of the lower esophageal sphincter. Some individuals with GERD can also experience excessive salivation. So this is known as water brash or acid rash, and this water brash or excessive salivation may be due to acid reflux irritating salivary glands. However, this is an uncommon symptom. Individuals with GERD can either have issues with dry mouth or issues with too much production of saliva. So either one can happen with GERD. Now there's some improving factors or things that make symptoms better. As previously said, symptoms might be worsened by lying down. If you're lying down and the lower esophageal sphincter is open, the contents of your stomach may pull back into your esophagus. However, if you're sitting up, gravity can help force those gastric contents down and stop them from refluxing into your esophagus. Eating more slowly can also help as well, and then avoidance of certain foods and beverages. Antacids can also improve symptoms of heartburn because they reduce the acidity in your stomach. There are also some other symptoms of GERD like pain while swallowing, difficulty swallowing, and a bad breath. If the gastroesophageal reflux disease is not properly treated, it can increase the risk for esophageal cancer. So please make sure you get checked out if you experience symptoms of gastroesophageal reflux disease. If you haven't already, please like and subscribe for more lessons like this one. Thanks for watching and I hope to see you next time.